start. Hello, my name is Scott. I'm a student physical therapist here at UMS. Today what I'm going to be doing is I'm going to be removing your old dressing, taking a few quick measurements and assessing your wound, and then replacing it with a new dressing. During this process, I will be moving you around and shifting you around a little bit. If you have any pain or discomfort, please let me know. Are you currently in any pain? No? Awesome. Please give me a few seconds to get my treatment area set up, and I'll be right back. And also just want to know that I have my mask on right now for preventative purposes. I'm going to go ahead and designate this side as the clean side, this side is the dirty side. Clean spot. I'm going to wash my hands. Good. Next, I'm going to go ahead and move my equipment over to the table. Next, what I'm going to do is I'm going to put on my mask. I'm going to go ahead and also put on some eyewear. And my gown. gloves. Next, I'm going to go ahead and drape the patient, cover up all the exposed areas, and then also put this towel underneath them. So I'm going to just shift you over. Please let me know if you have any discomfort or pain. Good. Also going to cover up any exposed areas. And next, I'm going to just slowly get the secondary dressing off. So I'm going to press down on the skin and peel away the skin from the tape, not the other way around. Good. And dispose of this. And next, I'm going to take out primary dressing, which looks to be just 2x2 gauze. And I note that there is minimal serous fluid exudate with no notable odor. Cleanse the wound. Take my first gauze to just wipe it down. Dry it out from the inside, going in circular motion outwards. Make sure to get the tunneling and the undermining present. Good. Now I'm going to get a new one to clean out the outside of the wound. Thoroughly dry it. I'm going to remove my first set of gloves. Tear off some tape. Good. I'm going to put this on the dirty side. Then I'm going to go ahead and replace these gloves. And now looking at the wound, just assessing the tissue type, I see that there is approximately 70% red tissue, 20% of yellow slaw, 5% of exposed bone, and then also some 5% of eschar. I also note that there is tunneling present, assuming this way is 12 o'clock, this way is 6 o'clock using the clock method. There's some tunneling present at approximately 9:30. And then also undermining present from 6 to 9 o'clock. So now I'm going to go ahead and assess length, width, depth, and the such. So first assessing depth. I note that there's approximately 2.1 centimeters at the deep spot of the wound for wound depth. And from the undermining present from 6 to 9 at approximately 7:30, there is approximately a depth of 1.7 centimeters. And for the tunneling present at 9:30, that is approximately 2.6 centimeters. So I'll make sure my tech documents all that. Dispose of that. And I'll go ahead and take the length. So the length looks to be longest from 12 to 5 o'clock. So getting a measurement of that. It is approximately 7.5 centimeters for the length. And the width from 3 to 9, the widest part of the wound, is approximately 6.2 centimeters. So all that's been measured. Looking at the wound edges, as stated before, it is unattached due to undermining from 6 to 9, and then also at 9:30 due to tunneling. The rest of the wound edge appears to be attached, and the peri wound looks to be intact and unremarkable. So next I'll get the peri wound wipe and go ahead and clean off the wound. Protect the peri wound. Good. And next, now that that's clean, I will begin to get the wound packed. So, using 4x4 gauze. 2x2 gauze as the primary dressing to make sure I get the undermining. Second 2x2 gauze to get some of the tunneling. Sure that's sufficiently packed. Third 2x2 gauze to make sure the rest of the wound is packed efficiently. I'm gonna use a 4x4 gauze to hopefully finish it off and get some of the eschar on the outside. Flush. And then I'm going to go ahead, make sure this is properly tacked. Good. Now I'm going to go ahead and use this last 4x4 as secondary to cover it all up. A little bit, and then use the tape to secure it. I'm gonna go ahead and date and initial it. Just 3/9. Put this on the dirty side. All right, good. So looks like your wound is healing up quite nicely. The wound outside looks nice, and we want to continue to promote that. So what we want you to do is we want you to place you on something called a turning schedule, to where you or a caregiver or even your spouse can help you turn over and change positions every 2 hours or so. This will help continue to promote proper wound healing of that wound and also prevent any further complications from occurring at all. If you need help turning, please let your nurse and caregiver know, and we'll also be able to remind them. If you have any signs of fever or see any redness in the area, that may be a sign of infection. And if you see that, please let one of us know, or even a caregiver or help staff, and we'll be able to address it immediately since that is pretty urgent. Do you have any questions for me? No? Awesome. Are you currently in any pain? No? Awesome. So I'm going to go ahead and remove some of these towels. So, thank you for your patience. Good. And then now I'm going to have my staff tie down. Awesome. Then I'm going to move my glasses. Okay. And then I remove my mask. I'm going to go ahead and sanitize my hands. Get rid of any excess items I have. Tape. Dispose of it in the appropriate area. Sanitize my hands again. And I'm going to go ahead and clean the spray bottle and put it in a separate clean area for it. Then now that I'm all cleaned up, I have to wash my hands to finish.